Hello, Calaveras County. And as you saw, the doctor is in. Dr. Randy Smart, how are you?
Hi, Mike. Thank you for inviting me today.
You bet. Now, this time around, I've got something that I think a lot of people get, and we just don't know what to do about them. And that's a bloody nose.
Nose bleeding. Mike, if you've ever had a nosebleed, it's a very important thing in your life, and we could talk a little bit about that. And if you've never had one, you wouldn't know that it's out there or is a problem. Mm-hmm. But actually, on the order of 60% of people will have nosebleeds in their life. So the majority of us have had nosebleeds at one time or another.
Is there something that, obviously there are some things that can cause them, and I know we're going to kind of get into that, but is it across the board between the sexes and the ages and all of that? Or?
You always ask such good questions. It's a little more common in men than women, and we think that's because the estrogen women take and produce has a sort of a protective effect against nosebleeds.
Oh.
Most people that get nosebleeds, well, I should back up a little bit. So most of my comments today really don't apply to children.
Okay.
And there are some specialty cases they wouldn't apply to. But certainly in the adult world and in the common nosebleed world, most nosebleeds occur between the ages of about 45 and 65.
Oh, okay.
So like many of the diseases we've talked about in the past, you can cruise right into your 40s and say, life is great, I'm having fun. And one day at work or wherever, suddenly you're blood on your shirt or blood on the table and go, what's wrong?
What's going on?
And I don't like this. I'll tell you something interesting, though, and this is really a personal observation, is people get very frightened when they're bleeding.
Oh, yeah.
Now that sounds a little bit stupid, but it's not, because, like, if your finger's bleeding, they don't like it, but they put a Band-Aid or
you can usually squeeze it tight enough to stop the bleeding.
Right. Or foot or scratch or, some minor injury, but... If you have internal bleeding, it's very frightening. So internal bleeding would be like maybe throwing up blood, nosebleed, perhaps vaginal bleeding or rectal bleeding. If you have internal bleeding, it's very frightening for people because, one, they don't know why, and two, you can't put pressure on it, and
to stop it.
You can't control it, right? Right. So it is really something that causes a lot of anxiety and fear in patients.
And, I think, not to mention, really, when we're talking about a nosebleed, it can be kind of dramatic.
It can be life-threatening.
Yeah, even if you're sitting in the office on a calm Wednesday morning, your nose starts bleeding and you can't get it to stop, and it becomes a very dramatic thing very quickly.
How long will it go on? What do I do? Why is this happening to me? Absolutely, and so those patients get very frightened, and when you see them in an office or even in an emergency room, they're pretty amped up. Because usually by the time they get that far, this has been going on a while. They don't know what to do. Yeah. The family's with them. But it can be a very big deal. Even the minor nosebleeds, just the kind of the visibility of the blood can be very upsetting to people if you get it on your clothes or the house.
Well, it turns on that sort of sixth sense or that extra awareness that's, now I have something that I have to be watching for is whenever I've had them. Because the occasions that I've had them have been...
So you're one of those 60%?
Well, I don't know that I've had nosebleeds per se, but I've had a couple where just sort of out of the blue, you blow your nose and then about 2 minutes later, something's going on,
that
and
counts.
You realize
that counts.
That's it.
That's a nosebleed.
I guess let's go to the very beginning and what's causing these, and then we'll get into the what do we do.
Right. So there are probably 15 different causes.
Wow.
But one of the most common causes is just very dry, cracked mucosa or the lining inside your nose.
Okay.
And so do you notice that I'm here in September talking about this? Mm-hmm. And the reason being is because the majority of the nosebleeds we see are in the winter.
Oh, okay.
And the reason we see them in the winter are two reasons. One is that most people use central heating.
Oh, mm-hmm.
Right.
Yep.
Some use wood stoves, and it can be a similar problem. But with central heating, it's super dry air.
Super dry.
I don't actually know what the humidity of central heating is, but it's got to be single digits. Mm-hmm. So that really dry air, then your nasal mucosa or nasal lining becomes really dry. And most people can feel that. They go, it feels like kind of like a wind tunnel, and it doesn't feel very moist, and things are kind of cracked. Well, that cracking then can crack a blood vessel or a capillary, and hence the nosebleed. Now, the nose is a very vascular part of your body.
Oh, okay.
And there are actually 3 different arteries. They've got big, long names, and I'm not going to go through this, but they've got 3 different arteries that all sort of terminate toward the tip of the nose.
Really? Okay.
So right inside your nose is a venous plexus. It's also got a big long name. And that venous plexus is usually the cause of these nosebleeds. It becomes cracked, it becomes dry. And then people have a tendency to kind of fuss with their nose. I don't really want to call them nose pickers because that's kind of pejorative, I think.
Yeah, a little bit.
But they, you get a little crust or a little itchy spot.
Kind of messing around with it.
Yeah, and they kind of mess. They get a Q-tip or something, a bobby pin, or I don't know. And so they tend to fuss with their nose, and then if their nose is bothering them, they tend to blow their nose. So those behaviors put them more at risk for a nosebleed, and if they're having nosebleeds, it certainly makes it worse.
It sounds like it can exacerbate it.
Oh, absolutely. Yeah, absolutely. So it's kind of a combination, probably in 90% of the cases, a combination of dry weather, dry nose, a little bit of scratching or picking. One thing leads to another, and suddenly there's kind of a drip, 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 and you've become one of the 60%.
You've got a bloody nose.
Exactly, yeah.
So then what do you do? Because to me, first off is the, oh crap, my nose is bleeding.
What do I do?
What do I do? Do we roll up the Kleenex and stuff it in there and, press on the side of our nose? How do, and how long can this go before it becomes a worry, I think is the other thing.
It can go a long time. It can go overnight. It can go for a day or two. And there are different scenarios, but the what do I do question, I would say there's kind of 3 scenarios. And one is, what do I do to prevent this?
Sure.
And I think the question you're asking is, what do I do when I'm bleeding?
When it's bleeding,
And the third question is, when do you go get help? Right? That's kind of what we're talking about.
Sure.
So what you do, patients have a tendency to lay back. That's the wrong thing to do.
Really? Okay.
Yes, absolutely wrong thing to do. Because what happens is the blood starts flowing posteriorly back into the pharynx. You tend to swallow. It tends to be really nauseating for many. There's something that's almost like a reflex. When there's blood in your stomach, you become nauseated. But it doesn't stop the bleeding laying back or laying down. So what we recommend people do, at least at first, is to plug their nose.
Oh, just kind of pinch it.
Tightly and kind of lean a little bit forward.
Okay.
So you want to be sitting upright. You want to pinch it, and then you want to lean a little bit forward.
Okay.
Now, usually that pinching should be nonstop for at least 10 minutes.
Okay.
And where patients get into a little bit of trouble is they do that for about a minute, and then they want to see if it's still bleeding.
Yeah.
So they let go, and it drips some more, and then they do it for another minute, and then it drips some more, and you can do that for a long time.
So it never ends up actually making the seal that we wanted to make with the 10 minutes of pinching.
Right.
It's kind of like waiting for the cupcakes to bake. You've got to wait until they're done.
So the pinching should really be about 10 minutes.
Okay.
Now, we have a little device that we make in my clinic where do you know what a tongue depressor is?
Mm-hmm.
Yeah.
Mm-hmm.
So we take two tongue depressors and we tape them together,
Okay.
and that becomes like a clothespin.
Oh, yeah.
And
And you just kind of
you
slide it on there.
clothespin it on there, and you wait 10 minutes.
And you wait 10 minutes.
And that way you don't have to have the pinching.
I'll be
But either
darned.
way, either way. So that's what you do. Now, there are other things you can do. And for example, there is a medicine that is an over-the-counter medicine called oxymetazolam.
Okay.
You're not going to recognize that name, but the name you will recognize is Afrin nasal spray.
Okay. Mm-hmm.
So anybody can buy a bottle of Afrin nasal spray, and if you've had problems with nosebleeds in the past and you want to have something around the house, then you can actually do a couple sprays of the Afrin spray and then do the pinching.
Oh.
And,
Okay.
and I'll tell you something is, if you were today to go to an emergency room with a nosebleed, I mean, not all nosebleeds are exactly the same, but in general, if you were to go to the emergency room with a nosebleed, that's what they would do.
Oh, really?
They would take some Afrin, spray it up each nostril, pinch your nose, lean forward. The doc will be back in 10 minutes.
In 10 minutes.
Yeah.
But keep holding your nose.
Right, do not let go. Yeah, do not let. So there definitely are things you can do about that at home. But you know what I would say to people is, with most symptoms or problems, you need to decide when is it time to get help. And I don't know, the threshold with nose bleeding, I think, should be a little bit low. You know, if it's bleeding and it won't stop bleeding, go get some help. Right?
Yeah.
And so if it's a little bit of dabbing and, you know, a little bit of stuff, you could probably go see your regular doctor in a clinic. But if it's bleeding and you know, you've got an entire box of Kleenex on the front of your face, you should go to an emergency room.
Yeah.
Absolutely.
Yeah. Now, if you've tried the 10 minutes and held it closed and it doesn't work after that 10 minutes, you've been religious about holding it closed, is after that 10 minutes and it's still going to bleed pretty healthy, is that okay, I need to be thinking about
Probably.
getting some help?
I mean, there is a little bit more you can do. You can get an ice pack, or, you know, like ice cubes and a washcloth, and you can put some ice on that.
Okay.
And that could potentially slow it down. But if you've held it 10 minutes or you're concerned, you should probably go get help. And, you know, people think, you know, emergency room, nosebleed, I feel like a fool. That's what they do. I mean,
what they're
that's
there
what the
for.
people in the emergency rooms do. And we've had patients, I don't want to be melodramatic, but we've had patients that needed blood transfusions from nosebleeds.
Oh my gosh.
Needed surgery for nosebleeds.
Wow.
Needed to be transported by ambulance to a university for nosebleeds.
Wow.
So you can definitely get into trouble. And I would kind of err on the side of getting some help.
Sure.
But honestly, of those 60% of people that get nosebleeds, about 90% of those manage them at home.
I was going to say, we don't usually end up, I don't think, at the emergency room for
most
those.
people don't. Most of them manage it at home, and they do it in a variety of ways, Mike. They will put in some Kleenex, or, you know, they'll lean forward, or, you know, it'll just stop spontaneously. But 90% of them manage them at home, and I would imagine for our audience, many people could do that. But you have to use judgment.
Is there a point where, let's say, I don't know, I don't want to set up too elaborate a scenario here, but what I was thinking is, let's say you get that particular week, and, you know, maybe it's been particularly dry in the house, but your nose is cracked, and it just seems like 2 or 3 times over the last 3 days you've had another bloody nose.
Yes,
you know,
exactly.
And so now it feels like we're setting up a pattern. Is that a definite go see the doctor? Something else is going on, or?
Probably. I mean, there are some unusual diseases. Well, for example, cancer can cause a nosebleed. Now, that's not real common, but it can happen, and tends to be a little bit in the older population. There are some very interesting bleeding disorders, big long names, that can do that, and
Okay.
you could possibly have one of those. Yeah, if you're having recurrent nosebleeds and you haven't had it at least looked at once, you should probably go talk it over with the doc. Now, if you've talked it over and they've said, look, this is related to your allergies or some other cause, and you're pretty comfortable about the cause, then you can manage those at home. Absolutely. And many people do.
As the physician, someone comes in saying they've had bloody noses. I'm guessing that you're going to look in there to see what the mucosa is looking like.
Sometimes.
What, because I would think that if you look in there and you see the Sahara Desert, you know that, the house is too dry, that kind
Right.
of thing. And maybe I'm swinging here toward prevention. Is this, what do we do to not get to the point where when we get the sniffles in the middle of winter that's looming, are we going to end up with bloody noses because we've blown our nose 5 times in the last hour?
Yeah, I think that, that's an excellent question. And I think there are things people can do to minimize their nose bleeding events, both the number of events and the duration of the bleeding. And so let's talk about that a little bit. If you've had recent nosebleeds, let's say you had one on Monday and you're trying to kind of not have one for the rest of the week, I mean, you can moisturize your nose. You can get like a salt water solution. You can buy these at the drugstore.
Yeah.
I think it's called Ocean Spray. I think that's what it's called.
There's a
Something
couple,
like
3
that.
different, and then there's some just regular old, almost like generic brands
Saline.
that are just saline
Right.
solution.
So you can moisturize your nose, and you can do that many times a day. And some patients, we say, look, do that every 2 hours for the next, couple days. I mean, not while you're sleeping, but
Yeah.
So you can moisturize your nose. Then, this is probably a little bit folklore, but I kind of buy into it. Is a lot of hot fluids, winter hot fluids, hot coffee, hot soups, causes vasodilatation and can make your bleeding recur and make it worse. I really believe that. I've never seen it published or written anywhere, but I really believe that. So kind of getting away from the hot shower, the hot bath, the hot soup, the hot coffee, the hot tea. I mean, it can be warm, but hot is probably a bad idea. And then people tend to kind of manipulate their nose a little bit. And let me give you an example of that. Like, we all kind of wash our face, every day, a couple times a day or whatever. Now, when you do that, you kind of scrub a little bit and
Sure.
you move your nose around, right? If you're a nose bleeder, that's not a really good idea.
Oh, that's right, because you're
Particularly
moving
if it's-
around that surface that could crack.
Right, exactly. Yeah, right. You're kind of pushing it, scrubbing and everything. And Americans are real scrubbers. I mean, we're clean freaks. And we should talk about that sometime. I'm not sure that's a really good idea. But, so you can wash your face without, manipulating your nose. And so those kinds of things, I think, can be really helpful in terms of prevention. Now, there's one thing we should really talk about, and that's the use of nasal steroid sprays.
Okay.
Okay. And so I think it was about a year and a half ago, maybe even 2 years, that there was a medicine called fluticasone, which is also called Flonase.
Okay.
Comes in a little green bottle.
Yep.
Costs, I don't know, $10 at the drugstore.
Yeah.
And lots of people use Flonase. And the reason they use it is because they have allergies. And in California, allergies are sort of a bimodal problem. There's a peak around April and May, and then there's another peak right around October, maybe even November.
Oh, okay.
Yeah, so it's the only state I know of that has bimodal allergies. trivia. But so people are using that Flonase for those allergies, and that's a wonderful idea. You and I have had shows where we've encouraged them to do that. But if you're overusing it, you'll get dry and cracked big
Nasal
time.
passages.
Big time, yeah. So the way you use the Flonase, I think, is really important. And for some patients, that can be every day. For more often, it should be every other day.
Oh, okay.
For some patients, it's twice a week. But you want to use enough that your allergies are reasonably controlled. Not a lot of sneezing, not a lot of dripping. But you still want the mucosa to be moist and not dry and cracked. And you can usually tell that. You can feel that.
You can kind of feel it because you're not feeling. You mentioned it earlier, the wind tunnel.
Feels like
and
a
I
wind
thought
tunnel,
that
right.
was really a good kind of maxim for it because
Just like
it's just this side of a whistle, you know.
right, exactly. So what I tell my patients is I say, look, Flonase is great, use it, but you know, and maybe even for a couple days in a row. Once you get these allergies under control, then back off.
Then start backing off.
Maybe every 2, maybe every 3. So that, I think that's important to know. And if you look at the warnings and advisements on the fluticasone package, they don't really go into that a lot.
Okay.
They just say, look, use it, you know, it controls your allergies. But it can be a real provoker with nosebleeds, and that's proven. In fact, if you're on, I read this stat over the week, if you're on Flonase, you're 20% more likely to have a nosebleed.
Wow.
Than were you not.
Hmm.
And again, the message here isn't to get off of it.
Yeah.
The message here is to control the way you use it.
It's to kind of only use what you need to keep your allergies in check, is what it sounds like.
Exactly.
If you're using Flonase, you've got the allergies, but you want to try and keep your nasal passages, I'm going to say moist, can you still use the saline solution even as you're using Flonase?
Oh, yeah.
Okay.
And in fact, what we recommend is use the Flonase first because it tends to open things up. And then you follow that with the saline because it tends to get better penetration.
Oh, okay.
So that's the way we start. But absolutely, you can use them both. Absolutely. And you can still use oral allergy pills. Like there's over-the-counter Claritin and there's over-the-counter Zyrtec and there's a number of them now. I can't remember them all, but there's no problem with using the pills, the spray, and the nasal spray. You can do all of that. You just have to make sure you don't dry up your nose.
One thing, and this is just because I've heard this from other physicians, and I want to make sure that folks understand, when we say the nasal spray, we mean the saline nasal spray, not the chemicals that are going in as a decongestant.
Right, we mean the salt water.
Yeah, it's a salt water spray basically, and the package will say saline solution, something like that, nasal saline or something like that.
Yeah, and the brand name I remember is Ocean Spray. But like you say, there's an entire aisle, inner aisle
of
nasal sprays.
Stuff to shoot up your nose, and actually from that whole aisle is where I was going with my comment about other physicians. Is I was told almost stay away from those. Now, I'm not talking about the Flonase for allergies, but it was for the other sort of decongestants, because you can get set up into a habit of, oh, my nose is clear, now my nose isn't, so I need more, and you get into this habit of always shooting your nose with more of this decongestant.
Absolutely.
And suddenly
there is a disorder, another long word, called rhinitis medicamentosa. And rhinitis medicamentosa comes from overusage of Afrin.
Oh, wow.
And so Afrin is a decongestant. That's why it helps you with the nosebleeds. And it can help you on a bad day with nose obstruction, allergies, edema. But if you use it more than about 3-4 days in a row, you develop a problem where every time you stop it, you have swelling and complete obstruction.
And it feels like your sinuses are all clogged up again.
Yes,
Yeah.
and so then you use it again and again and again.
Yeah.
And I think one of the worst cases I ever saw was actually in a kidney specialist that I worked with back in the 1980s. And he had a bottle of Afrin in his desk, in his pants pocket, in his car, in his house, because he couldn't live without it. And so there are ways around that. We see patients in Calaveras that have rhinitis medicamentosa, and there are ways around that, but it has to be thoughtful by somebody who has experience with how to do that.
Yeah.
But you're absolutely right.
Okay. Now we're down to about our last 2 minutes. So what I want to make sure folks understand is you've got a bloody nose. It's not really immediately something to get excited about, it doesn't sound like. Just kind of keep calm. Pinch your nose for 10 minutes. That's the trick,
10
is
minutes.
waiting that 10
Do
minutes.
not let go.
Don't let go.
Maybe an ice pack.
Maybe an ice pack. And if we get beyond that, then we start thinking about, okay, we need some help with this. One thing real quick I wanted to ask is this something that can happen to somebody like in the middle of the night while they're sleeping and they're going to wake up and really?
Yes, sir.
Okay, so
Yes, sir.
that can happen that way too. So
Yeah, 9 times out of 10, it'll wake you up. There's something about that
okay.
that'll wake you up, but you can do that. The
can do
patients
that.
I worry about, there's a lot of patients now that are on anticoagulation because they have heart disease or heart valves,
Yeah.
artificial heart valves. And so the patients on anticoagulation is a high-risk group, and those should not be managing their nosebleeds at home.
no.
They should be doing it with their cardiologist or their internist or
Yeah.
family doctor.
And that's a call first thing the next morning.
Yes,
Hey,
absolutely.
I just had a nosebleed last night. And that's to make sure that it does become a recurring thing.
Right, and you don't necessarily want to stop their anticoagulation because that could be a much bigger event.
Sure.
But they really need to be medically managed, and I wanted to make sure the audience was aware of that.
Yeah, okay. So we're careful. What about the athletic injury? When you get popped in the face and your nose bleeds, that's about the same thing, 10 minutes, and if it doesn't stop bleeding, then maybe you got injured more seriously than you thought?
Yeah, that's a hard question.
That's a tough one.
Trauma. I mean, you could have a nasal fracture, you could have a laceration. Those cases are really different, and if it doesn't stop bleeding in a reasonable amount of time, you should be evaluated.
You're getting to the doctor.
Right.
So we've done it here, folks. Dr. Randy Smart, thank you very much.
You're welcome, Mike.
You've kept our noses much healthier. We're
Clean.
going to be ready for our cold and flu season, so we're not going to go crazy scrubbing our noses this winter.
Right. That's exactly right.
All right, folks. The doctor has been in, and until next time, I'm Mike Taylor. Stay healthy.